All right, let's jump right in. We're going to tackle a really big question today. What if our entire health system wasn't just about fixing us when we're broken, but about keeping us healthy and well from the start? It's a huge shift in thinking, so let's explore what that actually looks like.
So think about it this way. Imagine you have the best fire department in the world. I mean, they're incredible at putting out fires, but there's not a single smoke detector in the entire city. Sounds kind of backwards, right? Well, that's pretty much where a lot of our health systems are today. They are fantastic at reacting to a crisis, but not so great at stopping that crisis from ever happening.
Okay, so this really breaks it down into two different camps. Over on the left, you've got the disease model. This is the one we're all familiar with. It's reactive. It's the ambulance waiting at the bottom of the cliff. But on the right, you have the health model. This is the proactive approach. This is about building a fence at the top of the cliff. And the problem is, most of our systems are still just running the ambulance service.
So you might be asking, if this reactive model has worked in the past, what's the big deal now? Well, the thing is, the world has changed dramatically, but our model for healthcare, it hasn't really kept up.
We're honestly facing a perfect storm. People are living longer, which is great, and our global population is growing. But the biggest challenge is this tidal wave of chronic diseases, things like diabetes, heart conditions, and obesity. And these aren't simple one-and-done illnesses. You can't just fix them with a quick prescription. They need long-term management, and our reactive system just isn't built for that.
Okay, so what's the solution? Well, it's not about inventing something brand new out of thin air. It's about bringing together two powerful allies that have, for way too long, kind of been working in their own separate corners.
Our first ally is primary care. You know this one. It's your family doctor, your local clinic. It's supposed to be the first phone call you make. It's designed to know you, to provide continuous, personal care over your whole life. It really is the backbone of the entire health system.
And then, our second ally is public health. Now, if primary care is focused on you, the individual, public health is looking at the entire community. It's the big picture. They're the ones behind massive vaccination programs, clean water initiatives, and campaigns to get us all to eat healthier.
Now, I want you to just look at this number for a second. Let it sink in. 7.4 hours. That is how long one single family doctor would have to spend every single day just on preventative care for their patients. We're not even talking about treating people who are actually sick yet. That's just the prevention stuff. It's absolutely impossible. That one number tells you everything you need to know about why the current system is totally overwhelmed.
So, the answer isn't to burn out our primary care doctors. The answer is to unlock the incredible power that gets created when these two allies finally team up. When primary care and public health stop working in their own separate lanes and start working as one team. And the payoff when they do team up, it's huge. I mean, we are talking about saving more lives, easing the incredible strain of all these chronic diseases, and just flat out improving people's quality of life. And here's the kicker. It actually saves the system money and makes healthcare fairer for everyone. It is a win-win-win.
Now, the best part of all this is that it's not just a theory. This isn't some fantasy. It's actually happening right now, in different ways all around the globe. So let's take a quick world tour and see 6 different ways this is already working.
Okay, here are 6 powerful ways to make this integration happen. First up, you can literally embed public health staff right into the primary care team, like they're doing in places like Brazil. Second, you can build formal partnerships between different organizations to tackle big problems together. A third way is to get insurers to offer benefit packages that actually cover and encourage preventative care. Fourth, you can co-locate services, put the doctor's office inside a public health center, making it a one-stop shop. Now, number 5 is a real game changer. Use financial incentives. You actually pay clinics more for keeping people healthy, not just treating sickness. And finally, number 6, training. Make sure everyone on the front lines, from doctors to nurses, has public health skills.
So all these different models, all these strategies, what are they all working towards? What is the ultimate goal here? Well, it's about making good on a really bold and inspiring promise that was made more than 40 years ago.
And this is maybe the most important takeaway of all. Weaving primary care and public health together isn't just a nice-to-have, it is the absolute cornerstone for making universal health coverage a reality. It's how we build a system that truly leaves no one behind.
It all comes back to this simple but incredibly profound idea, declared to the world way back in 1978, health for all. That's it. It's a fundamental human right, and bringing our health services together is the clearest path we have to finally making that goal a reality for everyone.
So as we wrap this up, I want to leave you with a question to think about. Picture your own neighborhood, your own family. What would actually change if the system around you was focused not just on reacting to sickness, but on actively building wellness for everyone? How would that transform the world right outside your door?